I thought you told me we only came here once.
You guys know what you're talking about?
Okay.
You are listening to EMS with your hosts, Erik Axene and Matt Ball.
Some of the most interesting patients I've seen in the ER environment have been jail patients.
Yeah.
Whether it's somebody brought to me for some problem in the jail, or I need to medically clear them, or a patient that's on the way to jail, I got to medically clear to get to jail.
Or you go to the jail. You ever had that? Or
well, no, I've actually never been to the jail, but we did have an area, one of the hospitals I worked at, which essentially was like a cell block.
A whole cell block?
Yeah, a bunch of, it was a county facility.
Oh,
and there was a whole wing there that was dedicated to jail patients and the high security.
Yeah.
You know, the double doors to get through. And anyway, it was, and you couldn't go in with a pencil. I remember that was the thing, is you couldn't write things down in those rooms. You had to, kind of write it down afterwards in the patient
before
record.
Cell phones. Couldn't record.
No, there's no cell phones or anything like that. This was a long time ago. But yeah, the jail patients, they need health care too.
Sure.
And sometimes they get hurt real bad.
Yeah. We had one of the districts I used to work in had a jail in it. And I remember two guys had come to my station. They were new to my station, my crew. And I mean, we would go to that jail fairly often. It wasn't like every shift you would go there. You'd go there, and they asked. They were like, well, how often do you go to the jail? I was like, I don't know, maybe once or twice a month we go up there, Literally that day, we went to the jail. We had 3 calls. For some reason, we only had 3 calls that day. All 3 calls were at the jail, and all 3 calls were for broken femurs.
Wow.
It was the weirdest, and then they all think, they're like, I thought you told me we only came here once. Yeah. We just went here. Yeah, that was weird. That was probably 17 years ago, and those guys still talk about that story. Wow. About how I told them we only come here once or twice a month, and we went there 3 times that day.
There's a femur bandit.
Well, no, it was all different situations.
Really?
Yeah. Anyway. Yeah.
Well, that's what they told you. See, that's the other thing I remember about jail patients. Is, I mean, not to be disparaging. I mean, these people have just as much value as you and me.
Sure, absolutely.
But one thing I noticed is that almost every time they're lying, and not because they're trying to manipulate. Well, they are trying to manipulate, but it's that they don't want to tell on somebody.
Right.
It wasn't a fight. I fell off my bunk.
Stitches.
That's right. Some of the funniest stories. Like, sir, I see the teeth marks.
Yeah, it didn't happen the way that you're telling me. Yeah, exactly.
Yeah, this doesn't happen. I had I guess this wasn't a jail patient, but I had somebody who lied to me that said she he had fallen into a swamp cooler, and that's where all the lacerations came from, on her arm or his arm.
Mm-hmm. Really?
And
fell into a swamp cooler.
Well, anyway, we found out later that she had an animal. A certain animal that Fish and Game would be very interested to know lived in her home with her. And she didn't want us to know that she had that particular animal.
Got it.
Yeah. Rhymes with tear, starts with B.
Anyway.
Yeah, really, serious. And I had another patient once that had gotten bit by his dog and said he had a blender accident. It's like, no, sir.
Puncture versus laceration.
You stick your hand in a blender, it's going to look different.
Totally different, yeah.
But didn't want anybody
get his dog euthanized or something.
People may not know this, but anytime a dog bite comes in, you have to call animal control.
Yeah.
Anyway, back to jail patients. They do sometimes say, like, I hit my head on the sink.
Yep.
Okay. It's like, no, I've had the opportunity and privilege of taking care of a lot of these patients.
Yeah.
And the vast majority of the time, very pleasant and enjoy meeting them and learning.
Yep. Oh yeah, they're interesting, and usually they're cool with us. Like when we're transporting, they're never usually a problem. They're usually pretty friendly with us. Now, if they have substances on board, that can sometimes change the way that looks.
True. Yes.
I have been cussed out and screamed at and every other thing while we got 14 dudes holding the patient down. But yeah, it's they're definitely interesting individuals.
Yeah, no, it's a challenge too. If we get a patient brought in by law enforcement on their way to the jail, it's a whole different set of circumstances where they usually have a net over their head. They've been spitting at people or who knows what.
Yeah.
And then we have to take care of them. We have to rule out life-threatening things before they bring them to prison.
Yeah. Oh, absolutely. And, it's always amazing how they get chest pain once they find out they're going to jail too.
I had a patient once that was brought in for chest pain.
Only once?
Well, no. This is interesting though.
Yeah.
I may have told you this story, but this patient was brought in for by law enforcement. Was pulled over for speeding, and said they had chest pain.
Yeah. Shocker.
And then ended up having a STEMI.
Yeah. Actually was having
one, and then but refused care. And so obviously we went through the whole, our acronym for refusals, ACDC. You know, this guy was autonomous.
Yeah.
He was obviously in custody.
I was going to say he's in custody though. Could he refuse? Because at that point they could say.
Well, we let him refuse.
Yeah.
We kept him in the hospital though because he was so sick.
Yeah.
He didn't look good.
Yeah.
But he had the legally he could do it, mentally he could do it, and I explained all the risks to him.
Right.
And he was actually agreeable to staying in the hospital, obviously, because he didn't want to go to jail. But but he refused to go to the cath lab for his STEMI. Wow. I mean, it wasn't subtle either. It was a real legit STEMI. I remember the cardiologist talking to him with me there too, just trying to convince this guy, "Hey, dude, you could die." Yeah. And he knew, and he says, "No, I will not go to the cath lab." And
really?
He didn't go. And we did send him to the ICU, and he ended up leaving against medical advice down the road. But anyway, kind of an interesting story.
That's crazy.
And a lot of these drunk drivers that are brought into us too, they will, for various reasons, have to stay in the hospital, and then law enforcement will follow them and stay with them until they're released, and then they. But anyway, there's our interaction in the pre-hospital environment with law enforcement. There's a partnership there. We've talked about it in previous podcasts too, right? Some jurisdictions, they've gotten into trouble with the relationships they've had with law enforcement, doing things that maybe they shouldn't do, not monitoring patients when they should, et cetera, et cetera.
No, we have a good relationship with our PD, luckily.
One of the most interesting things I've ever learned from my jail patient was how they do tattoos in prison. I was sewing up a laceration, and which is actually another funny story, but I was sewing up a laceration and learned that to make the tattoo ink, they will melt down a chest piece, burn a paper bag, and use the ash with VO5 shampoo, Vidal Sassoon, I think is what they said, VO5. I don't know what it is about VO5. Maybe it's any shampoo, but that's what he told me. VO5, trash bag, melted down chest piece, and a guitar string. Yeah,
I knew I've never heard the chest piece.
Yeah, they melted down the plastic, and anyway, so that's what they would use. And
so that's how they do it.
He actually, it was an interesting case I'll never forget. I think in an effort to teach me something, he got himself into trouble. But I'd run out of suture material sewing up the laceration on this young man. And he went to grab the scissors. And I honestly don't even know if he actually grabbed them. All I know is as soon as I turned around to grab more suture material, I just hear a melee break out in the room and turn around, and suddenly the law enforcement guys had tackled this guy because he went to grab for the scissors. And while I was turned away, they were afraid maybe he would use them. But he explained to all of us later, as things were calmed down so I could finish sewing them up, is that, I would have never hurt you. I just wanted you to know that I could have hurt you.
Don't ever turn your back on me.
Actually, I think his exact words were, "You're lucky that I do like you."
Yeah.
But it's an interesting clientele.
It is. They can be scary and intimidating. We had one, we got called to a jail for a suicide attempt, and showed up, had to go down into the pod area, got the patient, loaded him up. And, anytime we would transport a patient, obviously they're in custody. So you have a sheriff's deputy, typically they're in restraint, so you have to have a sheriff's deputy with you in the back of the ambulance. And then typically there's, might be one or two, whatever, driving. On this particular day, we could tell that there was something else unusual about this patient due to the heightened nature of their security. They were much more concerned about the security. And we didn't find all this out until after. We noticed that there was
something off.
There was something off for sure. There was something off with the guy. Like the whole situation was just kind of weird. We went into the hospital, and I mean, very quickly, we noticed there was officers all over the ER, and we were like, "What's the deal?" And we didn't find out later until that this individual that we had transported was a very high-ranking member of a very dangerous organization. And they were thinking that this was possibly an escape attempt because apparently he had threatened to try to escape. And so the police, the sheriff's office, they were concerned that this was an escape attempt, that he was faking this medical problem, to get out of the jail facility. And they thought that they were going to come storm the hospital that we had transported to try to bust this guy out. And so they had SWAT team there, clearing the ER, going through checking who's this patient, who's that patient. Yeah, it was interesting. It was that dude, just the way he was acting was a little nerve-wracking. It was something off.
I've been involved in similar situations, which are, we're just, everybody's there. I mean, it must have been everybody in that police department in that city was there.
Small town.
In the ER.
Yeah. And
it was this situation, it was on the news, and I am finding myself now in the epicenter treating this. It's pretty intense what the law enforcement community has to deal with. And when we have to interface with them, sometimes it can be pretty intense.
The only time I've ever been physically kind of threatened on a call was a patient who was was definitely under the influence of something, and had called. Family member had called, and this was early in a weekday morning, 7 a.m. Just me and my partner roll over to this house, walk in. Patient's kind of laying on the ground. What's going on? I don't know. He's acting crazy. Thought he was having a seizure. Okay, and I reach down and I go to kind of try to arouse this patient so he'd sit up, and he wakes up, and he gives me the crazy eyes, he's going to eat my soul. And it was oh, okay, that's surprising. And he gets up, and I'm not a big guy, but he was a bigger guy, and he's kind of coming at me. Luckily, whatever he was under the influence on kind of affected his coordination level. Also, luckily, his family member that was with him was trying to hold this patient back and communicating hey, they're here to help you. Called for PD, hey, we're going to need some help over here. And so we kind of just backed off and waited. And then PD came in with a purpose, and the rest of the family didn't like that because they thought they were coming in. And long story short, everything kind of calmed down. Everything was kind of good to go. We're okay, it's all good. Walking the patient over to the cot, and the patient kind of stumbled for a second, and I saw the cop grab a hold of the patient, and I thought, oh, here we go. Because as soon as he grabbed that patient, the patient started to fight, and then they started to get out handcuffs, and then the family thought they were arresting the guy, and I'm trying to tell the family, no, they're just trying to do it for his safety and our safety. No, it didn't matter. That guy was trying to bite us, spitting on us. Oh, just the fight was on. Yeah, it was interesting.
It actually happens a lot more than I think people realize. We're very comfortable with that in the pre-hospital environment, whether it's in somebody's home, in the ambulance, or in the ER.
Yeah.
They can be pretty dicey.
Oh, man.
And they really do present a risk to themselves and a risk to staff.
Yeah.
And you need to get control of them quickly, and you can't medically restrain somebody until you physically restrain them to at least get that going.
Yeah, you can't give them a shot or get an IV going until you get them under control. Yeah, jail patients are interesting.
One of the funniest jail patients I ever treated. This is interesting. So, in this at this particular hospital, there was a small wing of rooms within that area where we would treat jail patients for. Even in jail, you can get an appendicitis, right? So,
yeah, right.
But this particular patient was there for psychiatric reasons. I learned that oftentimes people will, whether they wanted to or planned to or whatever, will leave the jail by doing something intentionally. It's you want to get out of jail? Swallow this.
Right.
This one patient told me, I asked her, I said, how do you get the razor blades into the jail to swallow them? And what she would do is she would slide the razor blades into the antiperspirant or roll, or the deodorant stick inside the wax of that, and they'd be hidden in there, and that was the way she smuggled stuff in. She told me, but anyway, and then she'd swallow them, and then said
swallow the razor blade,
and then and say I just swallowed razor blades, and they would send her to the ER emergently to get taken care of. And those anyway, this particular patient in this at this hospital had actually been swallowed battery, and the battery, the battery acid can create lots of problems in your GI system. That the acid can eat through and can perforate things potentially. Anyway, so we had this patient swallowed batteries, and she would poop them out and swallow them again. And
the same battery.
The same battery, and she just kept doing it. And I remember, because once you swallow, you got to wait till she doesn't get to pass it. It's like, every time, ma'am, you can't keep doing this. We had to stop that cycle somehow. Well, she knew, I think, that once the cycle stopped, that there's no emergent need, and so she kept eating the battery and swallowing it again. And so my attending physician was really smart. I remember thinking to myself, man, Dr. So-and-so, that was a brilliant idea. I wish we had thought of that yesterday.
Yeah.
But he turned the water off to her cell. So there's no water going to the room.
Really?
And she was not able to stomach the battery without cleaning it with the water. But she tried.
That would be
anyway, it was anyway, but I'm sure a miserable place to be.
No doubt.
But anyway, there was stories like that, swallowing razor blades, swallowing all sorts of stuff. I've had patients who have swallowed knitting needles to hurt themselves.
We had a patient that used to do the razor blade thing. Yeah.
Yeah. Oh yeah.
Yeah, like but this wasn't in jail. He's just self-destructive. That's crazy.
Swallow utensils?
Yeah.
I mean, weird stuff.
Yeah. Very strange.
Yeah, that's the whole thing too. The other end, putting stuff in there. There's some funny stories there too. But this is the theme here, of course, is jail patients. Yeah. And the other thing that when I think jail patients, I've had 3 death threats against me, and one of them was a jail patient who really, he said the wrong things, and he said it with all the law enforcement folks there. And he said it in a way that wasn't some idle threat, It was, I've got a gun. And he was looking at my ID, and I'm coming back, and it was on that one. I don't think we actually filed a report or anything, but they can be scary, and they're very aggressive sometimes. If they're, it's not that they have anything against you personally. It's just that you happen to be there, and they're just mad as ever.
Yep. You're making them do something they don't want to do, and they're upset, mad. Yeah.
Sometimes the patients that'll come in by law enforcement will really want to stay in the hospital, not go to jail, and will pretend like they're passed out or fake a stroke, or we've I don't know. We kind of developed. We got a little. Every doctor, I think, has a little strategy to how they wake people up.
Oh yeah.
There's a
the pen on the thumbnail or the toenail.
Yeah. I'm just gonna grab this pen real quick here.
Don't you crush my finger?
I can grab it. There it is. You take your let me see your thumb.
I've seen it. I've seen you do it on patients before. I do the same thing.
Yeah,
it's extremely way more painful.
It won't damage the finger, but it hurts.
Yes.
Yeah, that you can pinch the trapezius muscle. That's you can do sternal rub, which is kind of the classic maneuver.
Yeah.
I've never done this before, but I've had a colleague of mine would stick an 18 gauge needle in their heel. I don't think that's appropriate, by the way.
Yeah, no,
don't do that.
Seems a little aggressive.
But that you can't fake that. The other thing that I do, though, that's really hard to fake, it doesn't damage anything or hurt them, but is the smelling salts.
Yeah. Yeah, we don't even carry it anymore.
Oh, in the ER we do.
Yeah, they've taken it off the ambulance. Now, I'm sure other people's ambulances haven't, but
I would take the smelling salt. I would open up the syringe, throw it in there, crack it, and then draw up the air, and then put it up the nose. It's
involuntary reaction.
You cannot.
It's kind of like the old arm dropping over the head trick.
Yeah.
If they do,
Yeah, that's true. Faking a stroke is something that'll happen from time to time too. And the interesting thing that folks don't know that haven't gone through medical school is to know that the sternocleidomastoid here, the SCM, this muscle on our neck that turns our head, the right one turns your head left, and the left one turns your head right. And so the folks that are coming in saying the right side is weak, you have them turn to the right. They can't do that, but they can turn to the left. But what they don't know is that uses the right-sided muscle. Same thing with the tongue. Moving your tongue to the right uses the left, and moving your tongue to the left uses the right. Yeah, it's kind of a thing. The other thing that was interesting too within kind of detecting a fake stroke is the lifting your legs. It's an involuntary reflex that you lift your right leg, you push down with your left. You lift your left, you push down with your right. Yeah. You can kind of put your hands under the patient's heels.
Enacting your abs. Yeah.
Anyway,
that makes sense.
Anyway, so those are interesting you can kind of see through that patient that's looking for the secondary gain of going to the hospital instead of jail, right?
Yes. Or staying in jail. Yeah, wanting to get out. Going to the infirmary.
Those are interesting stories.
Yeah.
I've told you the story about the STEMI.
Oh, yeah.
The jail patient with STEMI. Yeah, that was a good story. Did we tell that on this podcast, or have we talked about that before?
I don't think we told it on this one. I think we talked about it elsewhere.
It's good to that's an interesting situation because of the refusal.
Exactly. People call 911 all the time because, they think they're going to jail. Yeah. Yep. And then they end up
get chest pain.
Yeah, exactly.
Well, this guy had a STEMI. And he refused care appropriately. Yeah. And we didn't treat a STEMI, but I wanted to, but he wouldn't let me.
Yeah.
But he really had chest pain.
Yeah.
Most of the time we think they're being fictitious.
Well, most of the time they probably are.
Most of the time they are.
Yeah. But you can never know. You got to do your due diligence and check them out. Yeah, it's amazing how right when they want to go to jail, they all of a sudden have shortness of breath or trouble breathing or chest pain or something like that. Yeah.
Some of my favorite people to treat in these sorts of situations, which we haven't even mentioned yet, which is another probably 100 stories I've got, are treating the law enforcement officers who've been injured.
Oh, yeah.
Whether it's a gunshot wound or a broken leg or laceration from getting involved in an altercation with a patient. Those are some of the, to me anyway, I find a ton of fulfillment in being able to heal and help fix my law enforcement colleagues.
Yeah.
And they're always so tough too. It's like, I'm fine, doc.
I don't need any pain meds.
One of our colleagues here in our area was chasing a patient down into like a ravine and jumped from a pretty high height and broke both of his calcanei. It's calcaneus is your heel bone, but and he's like
both of them.
Yeah, I'm fine. I'm fine, doc. I'm fine. It's like, no, you're not.
That guy's not going to walk for a while.
No, he was hurt.
Man.
But it's gratifying and fulfilling to treat law enforcement personnel. That is a job that is so difficult, especially today.
Oh yeah.
It's not.
I don't envy their jobs.
Not an easy position to be in.
Yeah. They should have scored a little higher in the test. They could have been firemen, but we'll save that topic for another day.
Did you just say that?
I did. I've meant it too. No, I'm just kidding. My brother's a cop. I can say that.
I have a friend, an ER doctor actually, that keeps a chest tube in his car. So if he ever gets pulled over, he'll talk about how this is what'll save that guy's life when he's shot. And he's an ER doctor, and he thinks that's going to get him out of a ticket. And he thought that would be a good idea.
That's one way to try. I guess.
That's one way to try.
That's one way to try.
But it's true though. That when the law enforcement officers get hurt, or two firefighters in a fire can get injured. Same sort of a thing for me is helping. Because I don't have the skills to be able to fight a fire or do those things, but you do. And from time to time, like we've talked about in other podcasts, you're the first to run into the fire.
Well, I like it when ER doctors call 911.
Oh,
That's
really?
always fun for me, yeah.
Oh, yeah? What do they call 911 for?
Because, no, I'm just saying if they have to. And then they tell us how to treat them.
Smoke detectors?
Yeah. Oh, don't even get me started on grown men and smoke detectors.
Confession of an ER doctor here as we close this thing out. Here's a funny story. I got Debbie so mad at me. As I had a very high light in a stairway to get up to the studio.
Oh, yeah.
I set up 3 ladders as like a scaffolding.
Oh, yeah, been there, done
climbed up that, and oh boy, was she not happy.
I bet she was.
Kids
You're
loved
a
it,
doctor. What are you doing? Yeah, I've had to do some high ceilings. Yeah, change those light bulbs and smoke detector batteries.
Have you ever had to call 911 for you?
No, not for me. My wife has had to call 911 for my kids a couple of times.
Okay.
I had an issue And my wife asked me if she wanted me to call 911. I was like, absolutely not. Put me in the car and take me to the hospital.
I was the same way.
I better be unconscious. I'm going to have to be unconscious before you're calling 911 for me. Yeah, no.
Yeah, Debbie wanted me to do that, and I would not let her do it.
No, absolutely not.
She drove me.
No, if I can walk and talk, I'll be fine.
Yeah, and it was a broken limb.
Yep.
No, these aren't small things, I'm sure. And yours was no small thing.
Nope,
I mean, you were really not feeling well.
No, I was not feeling well. But yeah, no, I'm not calling 911. Yeah, jail patients are always interesting. We run to the jail pretty often, but they are always interesting, an interesting patient population.
Yep. And I think that the definition to me of a first responder includes law enforcement.
Yeah. No, I'm just kidding. I'm just kidding. Yeah, we'll go. That'll be another podcast for another day. We'll bring a cop in here and have that debate.
And oftentimes people include ER doctors as first responders, and I think we are certainly within the medical community.
Yep.
But what you're doing out there you're really the first responder by definition. I may be the first one in the hospital, but you and I think our law enforcement colleagues are the real true heroes and first responders. So there's nothing to I don't know. I don't think you can argue that.
Take all we all.
Oh, that's good stuff. Well, thank you for what you do. This has been a good, fun conversation.
Yeah,
a couple funny stories about jail patients.
Yep.
I'm looking forward to our next podcast.